Every single day, millions of people reach into their medicine cabinet, grab a small white pill, and swallow it without a second thought. A headache, a backache, a sore knee, nothing serious, nothing that feels dangerous. But here is something almost nobody tells you. Some of the most common pain pills sitting in your bathroom drawer right now may be quietly putting stress on your heart. Not in a dramatic way, not with warning bells. Silently, slowly, over months and years. And by the time most people notice something is wrong, they assume it is just age, just stress, just bad luck. It is not luck. Your body may be trying to warn you, and today we are going to talk about exactly how. If you or someone you love reaches for pain relievers regularly, especially after 50, this next 20 minutes could change the way you think about that little pill forever. Let's begin. Most people believe pain pills are simple. You feel pain, you take a pill, the pain goes away, and that is the end of the story. Take it, forget it, move on with your day. This is the common misunderstanding. Pain relief feels local. It feels like it only works on the sore spot, the aching joint, the pounding head. So naturally, people assume the pill only affects that one area. But here is what most people don't realize. These pills don't just travel to your head or your knee. They travel through your entire bloodstream. They touch your kidneys. They touch your blood vessels. And for certain types of pain relievers, they touch your heart. The real problem starts when these medications are used often, in higher doses, or for long stretches of time, especially in a body that is already dealing with high blood pressure, blocked arteries, or aging blood vessels. This changes everything about how we should think about a simple headache pill. So let's go deeper. What is actually happening inside your body when you take these medications? Here is the hidden mechanism. Explained simply, a large group of common pain relievers works by blocking certain chemical messengers in your body called prostaglandins. Think of prostaglandins like little messengers running through your bloodstream, delivering instructions. Some of those instructions control pain and swelling, but other instructions from these same messengers help control your blood pressure, help keep your blood flowing smoothly, and help protect the lining of your blood vessels. When you block the pain messengers, you often accidentally block the protective ones too. Imagine your blood vessels as a network of garden hoses. When everything works normally, those hoses stay flexible, water flows evenly, and pressure stays balanced. Certain pain medications can cause those hoses to stiffen slightly. They can cause your body to hold on to a little more salt and water than usual. And that combination can quietly push your blood pressure upward. At the same time, some of these medications can affect how easily your blood clots. A healthy balance is important here. You don't want blood that clots too easily, because that raises the risk of a dangerous blockage. This is where the hidden damage begins, not with pain, but with pressure building silently inside vessels that are already working hard. Now here is the frightening part. None of this hurts. You don't feel your blood pressure creeping up. You don't feel your arteries working harder. Pain is loud. This process is silent. And that silence is exactly why so many people never connect the dots. So why does this become more dangerous after 50 or 60? Your body today is not the same body you had at 30. As we age, our blood vessels naturally lose some of their flexibility. They become a little stiffer, a little less able to expand and relax the way they once did. On top of that, many people over 50 already have some combination of higher blood pressure, narrower arteries, or early heart strain, even without knowing it yet. Add in the fact that our kidneys, which help regulate fluid and blood pressure, also slow down slightly with age. That means the same pill that a 30-year-old body could shrug off may hit a 65-year-old body much harder. Inflammation also tends to run a little higher as we get older. Our nervous system becomes more sensitive to fluid shifts, and many older adults are already taking medication for blood pressure, cholesterol, or diabetes, which means pain relievers can sometimes interact with those other medications in ways that quietly raise risk even further. Your body is trying to warn you long before a real emergency happens. The trouble is, most of those warnings look like ordinary aging. Swollen ankles, slightly higher blood pressure readings at the pharmacy, feeling a bit more tired than usual. People brush all of this off. Almost nobody thinks, maybe it's the pain pills I've been taking every week. Let's make this real with a story. Meet a man we'll call Robert, 63 years old, a retired school teacher who loved gardening on weekends. For years, Robert had nagging knee pain from decades of standing in classrooms. His solution was simple. A couple of over-the-counter pain pills most mornings, sometimes more if the pain flared up. He didn't think twice about it. It was just a pain pill. Millions of people took them every day. But slowly, Robert started noticing small things. His ankles looked a little puffier by evening. His blood pressure readings at the pharmacy kiosk crept from normal into the slightly high range. He felt a little more winded walking up the same hill he'd walked for years. Robert assumed it was simply getting older. That's what happens after 60, right? It wasn't until a routine checkup that his doctor asked one simple question. How often are you taking pain relievers, and which ones? When Robert explained his daily habit, his doctor gently explained that certain pain medications, especially when used often, can raise blood pressure and add strain to the heart, particularly in someone Robert's age. Robert was stunned. He never imagined a headache pill from his own kitchen cabinet could be connected to his rising blood pressure. This is not meant to scare you. It's meant to open your eyes the way it opened Robert's. So how do you know if this might apply to you? Here is a simple at-home check you can do today. Think honestly about how often you reach for pain relievers in a typical week. Not just for headaches, but for back pain, joint pain, or general aches. If you find yourself taking them almost daily, or several times a week, for weeks or months at a time, that is worth paying attention to. You can also do something simple. Check your blood pressure at home or at a pharmacy machine on a day when you have taken your usual pain medication and again on a day when you haven't. Write both numbers down. If you notice a consistent difference, that is valuable information to bring to your doctor. Also pay attention to your ankles and feet in the evening. A little extra puffiness that wasn't there before can sometimes be an early clue that your body is holding on to more fluid than it should. None of these signs alone mean something is seriously wrong, but together, they are your body's way of raising its hand and saying, "Pay attention to me." So what can you actually do about this? Let's talk about a simple, realistic daily protocol. First, become aware of how often you are reaching for pain relief, and for what. Occasional use for a headache is very different from daily use for chronic pain. If you notice frequent use, that is your cue to talk to your doctor about safer long-term options for your specific situation. Second, ask your doctor directly which pain relief options are considered lower risk for your heart and blood pressure, especially if you already have any cardiovascular risk factors. There are often alternatives, including different medications or non-drug approaches, that may be more appropriate for regular use. Third, support your body's natural ability to manage pain and inflammation through daily habits. Gentle movement like walking, stretching, or swimming can ease joint pain naturally over time. Staying well hydrated helps your kidneys do their job more efficiently. Reducing excess salt in your diet supports healthy blood pressure, especially if you are someone who uses pain relievers regularly. Fourth, prioritize sleep. Poor sleep increases the body's inflammation and pain sensitivity, which can create a frustrating cycle where you feel like you need more pain relief simply because you are more tired and more sensitive to discomfort. Fifth, and this is important, never stop a prescribed medication on your own. If you are taking a pain reliever that was prescribed by your doctor for a specific condition, this is not a signal to quit cold turkey. This is a signal to have an informed conversation with your doctor about your options. Small, consistent changes like these are far more powerful than people expect. Now let's talk about timing, because change doesn't happen overnight, and it's important to be realistic. In the first few days of reducing unnecessary pain reliever use and adding gentle movement, some people notice slightly less puffiness in their ankles and feet. It's small, but it's a start. Within a few weeks, especially if blood pressure was mildly elevated, some people see modest improvements in their home blood pressure readings, particularly when combined with better hydration and reduced salt intake. Within a couple of months, many people report simply feeling more energetic day to day, with less of that heavy, tired feeling in the legs by evening. These are general patterns, not guarantees. Every single body is different, and your results depend on your overall health, other medications, and any underlying conditions you may have. Which brings us to something very important. This video is for education, not diagnosis. I am not a doctor, and this is not medical advice specific to you. Pain relievers, including common over-the-counter options, are safe and helpful for millions of people when used appropriately. The goal here is not to create fear. The goal is awareness. If you have high blood pressure, heart disease, kidney problems, or you are taking multiple medications, please talk to your doctor before making any changes to how you manage pain. And if you ever experience chest pain, sudden shortness of breath, pain spreading to your arm or jaw, or sudden severe symptoms, do not wait. Call emergency services immediately. This is true no matter what medications you have or haven't taken. Your doctor knows your full history, your other medications, and your personal risk factors. They are your best partner in making these decisions safely. As we come to the end of this video, I want you to remember something important. Your body is remarkably good at telling you what it needs if you learn to listen. The slight puffiness in your ankles, the blood pressure number that creeps a little higher, the tiredness that feels a bit heavier than it should. These are not just signs of getting older. Sometimes they are simply your body asking for a small adjustment. The encouraging truth is this: awareness changes everything. Once you understand how something as ordinary as a pain pill can quietly interact with your heart and blood pressure, you gain the power to make informed choices. You gain the power to ask better questions at your next doctor's visit. You gain the power to protect the heart that has carried you through every single day of your life. You don't need to be afraid of pain relievers. You simply need to respect them, use them wisely, and stay in close conversation with your doctor about what is right for your body. Take care of your heart the way it has taken care of you, quietly, faithfully, every single moment of every single day. If this video helped you see something in a new light, share it with someone you love who might need to hear it too. And take a moment today to check in with your own body. It might just be trying to tell you something important. Thank you for watching, and I'll see you in the next video.